Most people believe the first sign of dementia is forgetting things, forgetting names, forgetting where you put your keys, getting lost on a familiar road. But here is what the research and clinical experience actually shows. In many cases, the earliest changes have nothing to do with memory at all. They show up somewhere else entirely. And because they do not look like what people expect, they get missed for months, sometimes years. Today, I am going to walk you through 5 of those early signs. Some of them will surprise you. One of them you may recognize in someone you love right now. And I want to be clear about something before we begin. Noticing one of these things on its own almost certainly means nothing. These are patterns to be aware of, not reasons to panic. But if you recognize 2 or more, especially if they are new and people around you have noticed them too, that is worth a conversation with your doctor. Let us start somewhere nobody expects. Sign number 1. Changes in smell recognition. The first sign involves your sense of smell. Specifically, not just smelling things, but identifying what you are smelling. Here is why this matters neurologically. The nerve pathway that carries smell signals from the nose travels directly into one of the brain's memory and processing centers, an area called the entorhinal cortex, which sits adjacent to the hippocampus. These regions are among the very first areas where changes associated with Alzheimer's disease begin to appear. So when those neurons start to change, one of the earliest effects is not memory loss. It is a reduced ability to recognize familiar smells. Coffee that does not smell quite as strong, food that tastes flatter, not noticing burning toast or a gas smell the way you once would have. Researchers have tested this using what is called an odor identification test, asking people to identify familiar scents like peppermint, cinnamon, coffee, and roses. Studies have found that people who perform significantly worse on these tests are statistically more likely to develop dementia in the following years, compared to those whose smell recognition stays sharp. Before any concern sets in, a reduced sense of smell is extremely common with age, and millions of people experienced smell changes after COVID that took time to resolve or never fully returned. A gradual, partial reduction on its own is not a warning sign. What is worth noting is a clear, unexplained change in the ability to identify familiar smells, particularly if it came on without an obvious cause and has not improved over time. Not just smelling less, but smelling something and not being able to name what it is. If that pattern applies to you or someone you care about, it is worth mentioning to a doctor. Not because it means dementia, but because sometimes this pathway changes before memory does. Sign number 2. Loss of motivation and drive. The second sign is one that families almost always notice before the person themselves does. A quiet disappearance of interest. Not sadness, not depression, just a fading of engagement with things that used to matter. The football results are no longer checked. Phone calls to grandchildren are no longer made. A garden that used to be tended every morning is now left alone. A hobby set aside without explanation. In medicine, this is called apathy, and it is distinctly different from depression. Depression typically involves emotional pain, low mood, guilt, and a felt sense of suffering. Apathy is the absence of feeling. Not unhappy, just flat, disengaged. The pilot light, as one family once described it to me, simply went out. Research has identified new onset apathy in later life, particularly in someone without a prior history of depression, as a meaningful early marker associated with increased dementia risk. It falls under what clinicians call mild behavioral impairment, or MBI, and it has been linked specifically to Alzheimer's and frontotemporal dementia in its early stages. The reason this sign gets missed so often is that the person experiencing it usually does not feel unwell. They feel fine. It is the people around them who notice that something is different. If someone who loves you has said more than once that you seem different, less like yourself, less interested, please take that observation seriously. It may carry more diagnostic weight than any single test. Sign number 3, changes in word finding and speech. The third sign is one that almost everyone will relate to, which is exactly why it gets dismissed. You are mid-sentence and the word disappears. It is right there, just out of reach. You talk around it, substitute something else, and move on. And you think, that is just age. And most of the time, you are right. Occasional word-finding pauses in your 60s, 70s, and beyond are completely normal. The aging brain processes language slightly more slowly. That is not pathology. Here is the distinction that matters clinically. It is not the occasional blank that concerns me. It is when the blanks start joining up. When words are not just temporarily lost, but permanently replaced. When someone stops searching for the right word and starts consistently substituting an approximate one and does not notice they have done it. The microwave becomes the food heater. The remote control becomes the TV thing. Not once in a moment of distraction, but every time, consistently, without awareness. There is also a broader quality of speech to notice. Sentences that trail off, not because of interruption, but because the thought simply went. Conversation that feels slower, more effortful, flatter in rhythm. Pausing mid-sentence in a way that is new and noticeable. Here is a quick, informal test that clinicians actually use. Try naming as many animals as you can in 60 seconds. Go ahead and try it now if you like. Most adults over 60 produce between 15 and 20 animals. Getting above 12 is genuinely reassuring. Struggling to get past 7 or 8, or finding yourself repeating the same ones, does not indicate dementia, but it is a pattern worth mentioning to a doctor. The question to ask yourself about word finding is not whether it happens, it is whether it is new, whether it is getting more frequent, and whether other people have started to notice changes in how you speak. Those 3 filters together are your guide. Sign number 4, changes in walking and movement. The 4th sign is visible, not on a scan, not on a blood test, just in the way someone moves through a room. Think for a moment about someone you know well. You might be able to recognize them from across a car park simply by their walk, the rhythm of their steps, the way their weight shifts, the pace and pattern of their movement. Neurologists call this your motor signature. It is as individual as a fingerprint. Your brain coordinates that movement continuously and automatically, drawing on multiple regions working together. When the connections between those regions begin to change, it often shows in how you move before it shows in how you remember. Slowing down while walking is not on its own a concern. Arthritis, back problems, balance changes, and many other things cause that. What is more specific is a change in the pattern, steps becoming shorter and more shuffling, less natural arm swing, a new hesitation or uncertainty at thresholds and stairs. There is a test that reveals something important about cognitive reserve, the brain's spare capacity. It is called the dual task test. Walk down a hallway normally. That is fine. Now walk down the same hallway while naming animals aloud or counting backward from 20. A healthy brain manages both tasks together with minimal disruption to either. When cognitive reserve is reduced, the walking task requires more conscious attention, and the combined demand causes one or both tasks to break down. You slow significantly, shuffle, or stop walking entirely while thinking. This pattern can appear years before other cognitive changes become obvious. It reflects how much processing capacity the brain has available for automatic tasks that it used to handle without effort. If your walking pattern has changed and you cannot fully explain it with a physical cause, and especially if someone who sees you regularly has commented on it, mention it to your doctor. Sign number 5, acting out dreams during sleep. The fifth sign is one that the person experiencing it almost never reports, because they are asleep when it happens. Their partner, however, knows about it very well. It is called REM sleep behavior disorder, and it means that during the dream phase of sleep, the normal muscle paralysis that prevents you from physically acting out your dreams is not working properly. Ordinarily, when you dream about running or reaching for something, your brain keeps your muscles still. That is a protective mechanism. In REM sleep behavior disorder, that mechanism fails. The result is that people move, shout, kick, punch, or even fall out of bed during dreams, and wake up with no memory of it at all. Their partner, lying next to them, has often been dealing with it for months. This is not simply a sleep problem. REM sleep behavior disorder is one of the strongest early biological markers identified for a condition called Lewy body dementia, and it can appear years, sometimes a decade or more, before any noticeable cognitive change occurs. This does not mean everyone who moves during sleep has dementia or will develop it. Sleep talking, occasional movement, and restless sleep are common and have many causes. What distinguishes REM sleep behavior disorder is that the movements correspond to dreams and can be vigorous, hitting, kicking, calling out, acting out scenarios. If your partner has told you that you thrash, shout, or strike out during sleep, do not dismiss it. Mention it to your doctor specifically. It is the kind of symptom that changes what tests are run and what guidance is given. 5 signs. None of them involve forgetting names or losing your keys. Your sense of smell, specifically the ability to identify familiar scents, changing without obvious cause. Your drive and engagement fading, not through sadness, but through a quiet absence of interest in things that used to matter. Your words behave differently, not the occasional blank, but a pattern of substitution and change that others have begun to notice. Your walking is changing in pattern, and especially struggling to walk and think at the same time the way you used to. Your body acting out dreams during sleep, reported not by you, but by the person sleeping next to you. I want to say this directly and clearly. One of these signs in isolation is almost certainly not significant. Smell changes with age. Everyone loses words. Many people slow down. Sleep can be disrupted by many things. What matters is the combination. What matters is whether these things are new. What matters is whether the people around you have noticed changes that you may not have noticed yourself. If you are sitting here having recognized 2 or 3 of these, in yourself or someone you love, the appropriate response is not alarm. It is action. Specifically, a conversation with a doctor. Not because it means bad news, but because catching something early means options, treatment options, planning options, time. What early detection actually means. I want to address something that keeps many people from seeking evaluation, the fear of what they might find out. Early detection of cognitive change does not mean receiving a devastating diagnosis. In many cases, it means identifying reversible contributors, thyroid problems, vitamin deficiencies, medication side effects, sleep disorders, or depression that can mimic early dementia and are entirely treatable when caught. Even when a progressive condition is identified, earlier detection means earlier access to support, more time to make informed decisions, greater ability to participate in planning, and in some cases, access to treatments that are most effective in the early stages. The people who do best are not the ones who waited until symptoms were impossible to ignore. They are the ones who paid attention early, asked questions, and gave themselves time to respond. Noticing something is not the same as knowing something is wrong. It is simply information, and information, used well, is protective. Your brain has been working for you every day of your life. The least we can do is pay attention to what it is trying to tell us. If something on this list resonated, whether for yourself or someone you care about, write it down. Note when it started, how often it happens, and whether others have observed it too. Then bring that information to a doctor. That simple step is worth more than most people realize. If this video was useful, share it with someone in your life who might need to see it. A spouse, an adult child, a close friend. You may be giving them something genuinely important. And if you want more honest, evidence-based health conversations built specifically for adults over 60, subscribe to this channel. We are here every week. Take good care of yourself, and I will see you in the next one.